Okay. So today's topic is trauma to the kidneys. Injuries to the kidneys may occur as a result of a fall, a kick, or road accident. The injury may be anything from a bruise to a severe rupture or damage to the renal vessels. If the peritoneum in front of the organ is torn, peritonitis may occur. Injuries may be open or closed. We're going to talk about the two different types of injuries. They can be open injuries or closed injuries. Open injuries such as a gunshot or a stab wound. Open lacerations of the parenchyma collecting system are usually associated with other injuries within the abdomen. While closed injuries are of two types, namely direct blunt injury. They may be induced by a fall against the edge of the bathtub, or a blow or a kick in the loin. And remember, the loin is on the back between the thorax and the pelvis. These injuries are commonly associated with fractured ribs, and if on the right side, with injury to the liver. So if they're on the right side, they can then be associated with injuries to the liver. Major renal trauma, that's the second one, may occur as a result of rapid deceleration, as occurs, for example, in aircraft or accidents. So if an aircraft occurs, these can be major renal traumas. The pedicle, and the pedicle is known to be the stem or the neck of the kidney. The pedicle is injured rather than the kidney. The deceleration injuries to the pedicle may cause intimo tears, spasm, or thrombosis of the vessels. And when we talk of intimo, we're talking about the inside part of the vessels. So now we'll talk about the signs and symptoms of trauma to the kidneys. Number 1, hematuria. This will be seen in the urine of the patient. Loin pain. We can also have severe injury, which causes a mass or swelling in the loin, which increases in size. So this swelling or mass will be due to the accumulation of fluids once the injury has occurred. Signs, there will also be signs of shock, for example, tachycardia, hypotension, pallor, sweating, and others, which may be a sign of injury to other organs. The investigations we'll have to do in order for us to know that this person has a traumatic kidney injury. It can be urgent excretory urography to determine the extent of the renal damage. We can also do an angiography to assess the parenchyma and vesicular damage. We can also do a renal scan, which will show us maybe a swollen kidney or something. Then treatment. The first thing, since this patient is in pain, they will have to be on bed rest. In most cases, this helps the patient to heal quickly. And in severe cases, exploratory and partial nephrectomy will be done. So maybe partial of the nephron can be removed, or the whole lot of it. Then all urine voided is kept and turned in for evacuation, marked on the label, so that the amount of blood in each specimen is compared with that of the previous specimen. This trauma to the kidneys can come with many complications, such as infection of the urinary tract, bleeding, which is minor, shock, renal failure, hemorrhage, renal artery stenosis. And all these things can occur because the kidney is one of the most important organs of the body. So yeah.